When do you need to see a doctor if you suffer a boxer's fracture of your hand? I'm Dr. David Geier, orthopedic surgeon and sports medicine specialist. I provide education and commentary on sports and exercise injuries and injury treatments and injury prevention for athletes and active people so that you can stay healthy and perform your best. One of the common injuries that athletes suffer, often in fits of rage as they go to punch walls, or they're angry about something and they hit another object, or boxers do it as part of their fighting, hitting an opponent. Maybe mixed martial artists might do that as well, but that's an injury to the fifth metacarpal, and it's commonly called a boxer's fracture. The question is, what do you need to do about it, and how quickly do you need to see the doctor? In this week's Ask Dr. Geier video, we're going to talk about that exact question for a boxer's fracture. Mike asks, "Hi, I got a boxer's fracture on Sunday morning. I'm not able to find an orthopedic specialist with an appointment before Thursday. Am I risking more complication if I wait 5 days to have it treated? I went to an urgent care and got x-rays." Okay, first of all, let's talk about a boxer's fracture. That's the knuckle at the base, or I should say right below that knuckle on the fifth finger. The long bone is the metacarpal, and then right at the top of that, before the joint, that knuckle there, that's the fifth metacarpal head and neck. And what happens is you break that bone. Now, sometimes it breaks and lines up reasonably well, but a lot of times that bone angulates a little bit, and it's crooked. Now, you can accept a little of that and not have that much function in terms of like grip strength and things like that. But if it's angulated enough, maybe 40, 45 degrees, then as orthopedic surgeons, we like to line that up a little bit better. Sometimes that may be just manipulating it and then putting it in a cast or brace, something like that. Or, not uncommonly, we'll actually take you to the operating room and line that up a little bit better, and then maybe hold it in place with pins or something like that. Now, if you're going to do something like that, as surgeons, we want to do that really within the first couple weeks, but ideally even sooner than that, before that fracture starts to heal in the bad position. So I usually tell people, hey look, try to get this seen within the first few days. That way if you do need a surgery or need a procedure, it can be scheduled and it can be done in a time where that surgery doesn't get really, really hard. 5 days, probably not the end of the world, because the surgeon can still, get a procedure done, a few days after that. But you wouldn't probably want to wait much more than that. So I think that can be one of the good things to think about when you suffer these injuries. A good reason maybe to go get just an injury checked out and get x-rays early on and not wait a week or two, because a lot of times with fractures, the treatment and getting it to heal gets a lot harder the longer you wait. Okay, have you suffered a boxer's fracture, and did you need surgery for it or need to have it put back in place? I'd love to hear your thoughts. So below this video in the comments, leave your experience. I would love to read it. I'd love to hear how it went for you, and I bet people all over the world would love to hear your experience as well. If you like videos like this and you want more information on sports and exercise injuries and injury treatments and prevention, subscribe to my video channel. You can do it on YouTube, you can like my page on Facebook, but subscribe and you'll get videos like this that I record a couple of times a week delivered directly to you. Thank you so much for watching. I hope this video was helpful. Hopefully you haven't suffered a boxer's fracture, but I wouldn't be surprised if you have. That's maybe why you're watching this video. So I hope it was helpful, and I look forward to seeing you right here next time.